Whenever we are handed over an X-ray of the spine and we see some shift in the vertebrae, we always wonder whether that shift can be called as anterolisthesis or retrolisthesis. In this video, let's discuss step by step as to how we diagnose the shift to be antero or retrolisthesis. Step 1. Always use a lateral view X-ray, whether the X-ray is taken with a neutral spine, whether in flexion or in extension. We know that it is the lateral view of the X-ray when we see the term LAT written on the side of the X-ray. Sometimes the vertebrae behave very well in neutral spine and do not show any shift or instability. So thus, to challenge the vertebrae and the ligaments surrounding it, the clinician may ask the person to take an X-ray in the lateral view in flexion as well as in extension. Once we have taken the desirable view of the X-ray, we then compare the upper vertebrae with respect to the one below it. So if you see, the first one is checked with respect to the one below it immediately. The second one is checked with respect to the one below it, and so on and so forth. Step 3 involves the formation of an imaginary line called as the posterior vertebral line. Every vertebral body has an anterior border and a posterior border. So posterior vertebral line is an imaginary line joining the posterior borders of the vertebral bodies. Considering this is an X-ray of the lumbar spine, it is a line joining the posterior borders of the lumbar vertebrae and the sacral vertebrae. So once we trace the posterior borders, we need to see if any particular vertebral body has shifted anteriorly or posteriorly. Now, if you see in this X-ray, L5 has lost contact, the posterior border has lost contact in comparison to the posterior vertebral line and has shifted forward. So we can call it as anterolisthesis of L5 over S1. Likewise, we can see here that there is a posterior vertebral line that is drawn tracing the vertebral bodies of the lumbar and the sacrum. But we see that the L5 here has shifted backwards, thereby breaking the posterior vertebral line. So it is a retrolisthesis of L5 over S1. Meyer-Dick has provided a grading scale for listhesis, which describes the listhesis from grade 1 to grade 5 based on the slip that you can see on the X-ray. For more information, you can read the article on spondylolisthesis